I want to tell you about a patient. I'll call him Howard. 71 years old, retired mechanical engineer, lives in Ohio with his wife. Sharp mind, steady hands. The kind of man who rebuilt a 1967 Mustang in his garage just because he wanted to see if he still could. Howard started waking up at 2 in the morning. Not from noise, not from pain exactly, from a feeling in his feet. Numbness, tingling, like his feet had fallen asleep, except he hadn't been sitting on them. He'd shake them, walk to the bathroom, run warm water over them. It would ease up. He'd go back to bed. At first it happened once or twice a week. Then every night. Then it started creeping in earlier, before he even fell asleep. His wife noticed he was restless. He mentioned it at his next checkup. His doctor looked at him, smiled, and said, "Howard, you're 71. Circulation slows down. It's normal." 2 more doctors. Same answer. Normal for your age. 14 months later, Howard got up at 3 a.m. to use the bathroom. His feet were completely numb. He didn't feel the wet tile. He slipped, fractured his wrist. His wife found him on the floor. That fall was not an accident. It was the result of 14 months of ignoring a symptom that everyone kept calling normal. It wasn't normal. It was a signal. 3 different signals, actually, all firing at once. And nobody listened. My name is Dr. Ethan Carter. I've been a general surgeon for 20 years. I've operated on hundreds of patients whose problems started with something small. Something they noticed but didn't act on. Something a doctor dismissed. And by the time they reached my operating table, the window for a simple fix had closed. Today, I'm going to tell you 5 real medical reasons your feet go numb at night. Not 5 possibilities. 5 evidence-based causes that I have seen personally, that are backed by published research, and that affect millions of Americans over 60 right now. More importantly, I'm going to tell you exactly when to worry, what to ask your doctor, and which simple tests could change everything. But first, a question that almost nobody asks. Why does numbness get worse at night? During the day, your brain is busy, processing vision, movement, conversation, decisions. It filters out low-level nerve signals. You might have mild numbness in your feet right now and not even notice because your brain is occupied with this video. At night, when you lie still and the world goes quiet, your brain has nothing else to process. It turns up the volume on every signal coming from your body, including the damaged ones. That tingling you feel at 2 a.m. may have been there all day. You just couldn't hear it until the noise stopped. A landmark 2025 study published in the Journal of the American Geriatric Society screened over 1,000 adults aged 78 to 100 and found that 62% had measurable signs of peripheral neuropathy. The vast majority had no idea. Their nerves were already damaged. They just hadn't noticed yet. That is how quietly this happens. Now, the 5 reasons. The most common cause. And paradoxically, the one most often caught too late. Diabetic peripheral neuropathy. If you have diabetes, you've probably heard of it. But here is what most people don't realize. You don't need a diabetes diagnosis to have diabetic nerve damage. Prediabetes can do it. And prediabetes is silent. Right now, approximately 98 million American adults have prediabetes. That is more than 1 in 3. And roughly 80% of them don't know it. Their fasting blood sugar might come back at 110, 115, 118, just below the diagnostic threshold. Their doctor says the number is fine. Meanwhile, their blood sugar has been running slightly elevated for years, quietly damaging the smallest blood vessels in their body, the vessels that feed the longest nerves, the ones that reach all the way down to your toes. That is why numb feet are often the very first sign. The longest nerves fail first. The damage starts at the tips of the toes and creeps upward. The classic stalking pattern. And it is almost always worse at night. Because when you lie flat, blood flow to the extremities decreases slightly, and the nerves that are already starving for oxygen feel it most. Howard's fasting glucose was 118, right below the threshold. Not one of his 3 doctors ordered an HbA1c test. When I finally ordered one, his result came back at 6.8%. That is pre-diabetes, and it had been quietly destroying the nerves in his feet for at least 5 years. Here's what I need you to understand. Fasting blood sugar is a snapshot, one moment in time. HbA1c is a 3-month average. It tells you what your blood sugar has actually been doing while nobody was looking. If your feet go numb at night and you have never had an HbA1c test, that is the first thing you should ask for. Not next year, at your next appointment. And if your HbA1c comes back elevated, even in the pre-diabetes range, the nerve damage may still be reversible with early intervention. Diet, exercise, blood sugar control. But the window closes. Once the nerves die, they don't come back. Early detection is everything. Reason number 2. And this one is personal for me, because I have seen it cause permanent damage in patients who could have been saved with a blood test that costs less than a cup of coffee. Vitamin B12 deficiency. B12 is essential for producing myelin, the protective coating that wraps around every nerve fiber in your body. Think of it like insulation on an electrical wire. Without it, signals leak, they misfire, they short circuit, and you feel it as numbness, tingling, burning, pins and needles, especially in the feet, especially at night. After age 60, your stomach naturally produces less of a substance called intrinsic factor. That is the molecule your body needs to absorb B12 from food. So even if you eat plenty of meat, fish, and dairy, you may not be absorbing enough B12 to keep your nerves healthy. The deficiency creeps in over years, so gradually that you barely notice. But here is where it gets serious. 2 of the most commonly prescribed medications in America accelerate this problem dramatically. Proton pump inhibitors, omeprazole, pantoprazole, lansoprazole. Taken by roughly 15% of American adults for heartburn and acid reflux. Many for years, some for decades. These drugs suppress stomach acid. Without stomach acid, B12 absorption drops. Not partially, almost completely. And metformin, the most widely prescribed diabetes medication in the world, also proven to reduce B12 absorption significantly over time. So picture this, a 70-year-old woman taking omeprazole for reflux and metformin for blood sugar. Both medications quietly draining B12 from her body for years. And nobody checks her level because B12 testing is not part of standard blood work. It is not in the guidelines. You have to ask for it. Howard had been on omeprazole for 6 years. His B12 level came back critically low. 6 years of his nerve insulation being slowly dissolved, and not one doctor had checked. Here is the part that should make you angry and hopeful at the same time. If caught early, B12 deficiency neuropathy is one of the most reversible forms of nerve damage. Methylcobalamin, a form of B12 taken under the tongue, bypasses the stomach entirely. No acid required, no intrinsic factor needed. It goes straight into the bloodstream. 1,000 micrograms daily, over the counter, often under $10 a month. If caught late, after years of deficiency, the nerve damage can become permanent. Irreversible neurological impairment from a vitamin deficiency that a simple blood test could have detected. If you are over 60, especially if you take a PPI or metformin, ask your doctor to check your B12 level. Write it down right now. B12. That is all you need to remember. Reason number 3. This one surprises people because the medication they take every single morning could be the very thing causing the numbness they feel every single night. Statins. Atorvastatin, rosuvastatin, simvastatin. If you are over 65 in America, there is roughly a 1 in 3 chance you are taking one right now. They lower cholesterol. They reduce cardiovascular risk. For patients with established heart disease, statins save lives. I am not disputing that. But peripheral neuropathy is a documented side effect. The American Academy of Neurology has reported that patients on long-term statin therapy show a significantly elevated risk of developing peripheral neuropathy compared to non-users. A Danish population study found that patients taking statins for 2 years or more had a 4 to 14-fold increase in neuropathy risk compared to matched controls. Now, I want to be balanced here. The American Heart Association stated in 2019 that there is no convincing evidence for a definitive causal relationship. The debate in the medical community is ongoing. But what is not debatable is this. Thousands of patients have reported the onset of numbness, tingling, and burning in their feet after starting statin therapy. In many cases, symptoms improved or resolved after stopping the drug. And in cases where the statin was resumed, symptoms returned. The mechanism may involve how statins affect mitochondrial function in nerve cells. Statins block the mevalonate pathway, which produces not only cholesterol, but also CoQ10, a molecule critical for cellular energy production. When nerve cells lose energy, they lose function. And the longest nerves, the ones in your feet, are the most vulnerable. There is also emerging evidence suggesting that when cholesterol levels are driven too low, nerve cells may lose the raw material they need to repair and maintain their myelin sheath. The very insulation we talked about with B12. Different mechanism, same result. I want to be absolutely clear. Do not stop your statin without talking to your doctor. Statins prevent heart attacks. Statins prevent strokes. The goal is not to stop the medication. The goal is a conversation. If your foot numbness started or worsened after beginning a statin, bring that timeline to your doctor. Ask, could my symptoms be related to this medication? Is there an alternative statin or dosage that might reduce this effect? Has anyone checked my CoQ10 levels? That conversation alone could change your nights. Reason number 4, and this one is the great imitator. Because the numbness feels exactly like it's coming from the nerves in your feet, but it's not. It's coming from your spine. Lumbar spinal stenosis, the narrowing of the spinal canal in your lower back. As we age, the vertebrae develop bone spurs, the ligaments thicken, the discs bulge. The space around the spinal cord and nerve roots gradually shrinks. When it shrinks enough, it presses on the nerve roots that supply sensation to your legs and feet. Imaging studies suggest that some degree of lumbar spinal narrowing can be found in a very large proportion of adults over 60, though many will never develop symptoms. But for those who do, the symptoms can mimic peripheral neuropathy almost perfectly. Numbness, tingling, burning, both feet. So how do you tell the difference? There is one clue that I teach every patient, and it is remarkably reliable. Spinal stenosis numbness changes with position. It gets worse when you stand upright or walk. It gets better when you sit down or lean forward. That is why many patients with spinal stenosis notice they feel better pushing a shopping cart. The forward lean opens the spinal canal slightly and takes pressure off the nerves. If your feet go numb when you walk, but feel better when you sit and lean forward, that is a critical clue pointing toward your spine, not your peripheral nerves. Now, here is why this matters for nighttime numbness specifically. When you lie flat on your back, your lumbar spine extends. It straightens out. And that straightening narrows the spinal canal further. More compression, more numbness. Many patients with spinal stenosis discover, often by accident, that sleeping with a pillow between their knees or curling into a slight fetal position reduces their symptoms dramatically. That positional relief is the signature of spinal stenosis. Howard's MRI showed moderate stenosis at L4, L5, a narrowed canal pressing directly on the nerve roots that feed his feet. Nobody had ordered imaging because everyone assumed peripheral neuropathy. If your numbness changes with position, especially if it's worse when standing and better when sitting, tell your doctor exactly that. Those words will redirect the entire diagnostic process. And the good news is that for many patients, specialized physical therapy focused on flexion-based exercises can significantly reduce symptoms without surgery. The spine responds to targeted treatment, but only if someone looks there first. Reason number 5. And this is the one I need you to pay the most attention to. Not because it's the most common, but because it's the most dangerous. Peripheral arterial disease, PAD. Hardening and narrowing of the arteries that supply blood to your legs and feet. The same process that blocks coronary arteries and causes heart attacks. The same atherosclerosis. Just happening further from the heart, where nobody is looking. PAD affects an estimated 8 to 10 million Americans. The prevalence increases sharply after age 60, and the majority of people who have it do not know because the symptoms get blamed on arthritis, aging, muscle soreness, or peripheral neuropathy. Here is how PAD causes nighttime numbness. Your arteries are partially blocked. During the day, when you're upright and moving, gravity helps push blood down to your feet. Your muscles contract and pump blood through the legs. You get just enough oxygen to the nerves and tissues. At night, you lie flat. Gravity no longer assists. Your heart rate slows. Blood flow to the feet drops to its lowest point of the entire day. The nerves that were barely getting enough oxygen during the day are now genuinely oxygen-starved, and they let you know. Numbness, tingling, cold feet, sometimes actual pain. But here is why PAD is the most dangerous item on this list. It is not just a foot problem. It is a window into your entire cardiovascular system. A person with PAD has a 4 to 5-fold increased risk of heart attack and stroke. The blocked arteries in their legs are telling you that the arteries in their heart and brain are likely narrowing too. Numb feet at night, in this context, is a cardiovascular warning. There are signs that point to PAD rather than nerve damage. Feet that are noticeably cold compared to the rest of your body. Skin that appears pale or slightly bluish, especially when elevated. Hair loss on the toes and lower legs. Wounds or small cuts on the feet that take unusually long to heal. And the classic symptom, pain or cramping in the calves when walking that goes away when you rest. Doctors call this claudication. Most patients call it getting old. There is one test that can detect PAD in 10 minutes, the ankle brachial index, ABI. A blood pressure cuff is placed on your ankle and compared to the pressure in your arm. That ratio tells you how well blood is flowing to your feet. It is painless. It is non-invasive. it is one of the most accurate cardiovascular screening tools in existence. And it is almost never performed in a standard appointment unless the patient specifically asks for it. Howard's ABI on his left side came back at 0.72. Normal is above 1.0. Anything below 0.9 confirms PAD. His result indicated moderate disease. He had been living with reduced blood flow to his feet for years. Nobody measured it because nobody thought to ask. If your feet are numb at night, and they are also cold, and the skin looks different, ask your doctor for an ABI. 10 minutes, no needles, no radiation. That test might be the most important thing you do this year. Not for your feet, for your heart. Now I want to pause here because I do not want to leave you lying awake tonight worrying about your feet. Not every episode of numbness is a medical emergency. Let me give you a clear framework. Temporary numbness is normal. If you sit cross-legged for too long and your foot falls asleep, that is positional compression. The blood flow was restricted. You move, the feeling comes back. That is not disease. If you wear tight shoes all day and your toes feel numb at night, try different shoes before you call your doctor. If you sleep in an awkward position and wake up with one foot tingling and it resolves in a few minutes, that is mechanical, not pathological. Here is when you should worry. When the numbness happens consistently, night after night, for more than 2 weeks. When it is getting progressively worse over time. When it affects both feet in a similar pattern. When it is accompanied by any of these: weakness in the legs, changes in skin color, wounds that heal slowly, loss of balance, or pain when walking that improves with rest. Any of those combinations takes this from an inconvenience to a signal. And let me say this as directly as I can. If you are Googling, "Why do my feet go numb at night at 2 a.m.?" your body is already telling you something. Listen to it. Bring it to a doctor. Do not let anyone tell you it is just your age until they have done the work to rule out everything else. Let me come back to Howard. When I finally sat with him for a full evaluation, not 7 minutes, but 40, we found 3 of the 5 causes on this list happening simultaneously. Prediabetes with an HbA1c of 6.8. Severe B12 deficiency from 6 years of omeprazole use. And moderate peripheral arterial disease with an ABI of 0.72 on the left. His MRI also revealed spinal stenosis at L4-L5, contributing to the picture. Not one problem, 3, running in parallel, each one making the others worse. And for 14 months, every doctor saw one piece and assumed they had the whole picture. Here is what we did. His HbA1c was addressed through dietary changes and structured walking, supervised by his cardiologist to account for the PAD. Sublingual methylcobalamin was started immediately, 1,000 micrograms daily. His omeprazole was tapered gradually under his gastroenterologist's supervision. His PAD was managed with medication, including a statin at an appropriate dose, with CoQ10 supplementation, and monitored with ABI checks every 6 months. Physical therapy targeting lumbar flexion exercises was started for the spinal stenosis. Nothing dramatic, no surgery, no breakthrough drug. We simply identified what was actually happening, stopped making it worse, and gave his body the tools it needed to stabilize. 4 months later, Howard called me. He said, "Dr. Carter, I slept through the night for the first time in 2 years. The numbness had decreased by about 70%. He was walking confidently again. He felt safe getting up at night. His wife had stopped worrying. Not cured, improved." because we finally listened to what his feet had been trying to tell him. Numbness in your feet at night is not a diagnosis. It is not a sentence. It is a signal. And signals are only valuable if someone listens. Here is what I want you to do before your next appointment. Write down 3 questions. Tape them to your refrigerator if you have to. Bring them to your doctor and read them out loud. Question 1. Have I ever had an HbA1c test and a B12 level checked? Question 2. Could any of my current medications be contributing to nerve symptoms? Question 3. Should I have an ankle brachial index test? 3 questions, 5 minutes. They could change the next 10 years of your life. If your doctor engages with those questions, sits with you, orders the tests, that is a doctor who is listening. If they dismiss you, if they tell you it's just age without doing the work, that tells you something too. And it might be time for a second opinion. You have spent decades trusting your body. Your body has never lied to you. If your feet are talking to you at 2 a.m., it is because they have something important to say. If this video helped you understand what might be happening, share it with someone who needs it. A parent, a spouse, a friend who keeps saying their feet are numb, but nobody can figure out why. That one share could be the thing that prevents a fall, catches a disease early, or simply gives someone a full night's sleep for the first time in years. Everything I've shared today is general medical information based on published research and my clinical experience as a surgeon. Your situation is unique. Before making any changes to your care, please have a full, honest conversation with your own doctor or specialist. They know your history. They know your body. And that conversation, informed, direct, and unhurried, is exactly where good medicine begins. Take care of your feet. They've been carrying you your whole life. The least we can do is listen when they ask for help. I'm Dr. Ethan Carter. Stay strong, stay informed, and never let anyone tell you that what you feel isn't real.